She says, consent by cash coercion does not and cannot constitute voluntary informed consent. Why not just take the cash out of this equation? There are ways in which you could help people, point them towards free contraception or maybe even free sterilization, but you insist on putting a cash bribe in
We already
there.
have free birth control. They can walk into a clinic and get free birth control anytime they want. They're not doing that. They don't want to take the time out of their lives getting high, finding drugs, prostituting to get money to buy drugs. They don't have the time to do that. So the money gets their attention, keeps them focused long enough to do what they know anyway, and enables them to follow through because they know that they will get the money. It is the money that is working. Without the money, we have the same thing that we already have, which is nothing.
We've talked a lot about ethics. Let's talk a little bit about the medical evidence and the science as well. When you began your movement, Project Prevention, it seemed, and you argued, that women who were on crack cocaine, for example, who had children, who had babies, were passing on an addiction and deep damage to those babies. But there is a lot of scientific evidence now that suggests that this idea of crack babies is a myth.
So once again, it's a gamble because they found out that some of the babies are not going to be severely damaged. Let's go ahead and let them continue to have these babies. I know for a fact that it damages babies because I've known the children who have feeding tubes in their stomachs, tubes to breathe with. So it does damage their children. Maybe not all of them. So once again, it's a gamble. Let's go ahead and let them continue to have them because some may be born normal.
Well, but you know, you keep bringing it back to the anecdotal, but don't you believe there is a role for scientific analysis here? And I'll just quote you a raft of science.
I also believe that probably all these scientists haven't adopted any of these children, but they're the first ones to throw out the evidence to say let them keep having the babies.
But it's important. If it's not true, actually, that mothers who abuse drugs are passing on deep damage and addiction to their babies, then it does alter the equation,
But it's
doesn't
not
it?
true for every child, but it's not true for every child, because I know different. I've seen the children, and it's a bigger picture than just the fact that these women shouldn't conceive babies when they're using. It's what happens to them after they're born. What happens to the ones that end up in foster care, going from home to home to home, never feeling loved, never feeling cared about. It's a bigger picture than just the fact that they shouldn't conceive these children. It's the type of life they're going to have.
No, sure it is. But you know, you're motivating a lot of supporters and financial resources behind a particular approach, which is to be preoccupied with the drug addiction element and with the sterilization long-term contraception element. My point to you is that partly because of the science, surely you could now accept that there's much more worth to offering help and support to these vulnerable women before they have children and after they have children, because these children are not necessarily doomed to live wretched lives.
I disagree.
But, you know, again,
I disagree because
look at
it's
the
not
science.
just about
Professor Michael Lewis, a leading pediatric doctor in the United States, factors like poverty and poor parenting are much more likely to damage a child's intellectual and emotional development than the mother's drug abuse.
But it's not just about that. It's not just about the scientific studies. It's about the child. Just because these people make a lot of money to do scientific research and they come up with something saying all crack babies aren't going to be born damaged, that's not enough to make me say, after what I've seen these children. I brought them home from the hospital. I've seen how they suffer. I've seen the children that spend 18 years in foster care, and at age 18 they become homeless because the check runs out. 50% of foster kids in the U.S. become homeless at age 18 because there's no more check. The cycle repeats itself. I've seen kids have called me and told me that they've lived in 25 foster homes growing up. They never felt loved. It's a fact that 70% of foster kids end up in prison.
But
I mean, it's a bigger picture than...
If you're not careful, you're going to be arguing for a massive extension of your sterilization program, because what you really are talking about with the use of the sterilization and long-term contraception for certain sorts of women is something which to many people sounds very close to, dangerously close to, eugenics, social engineering, creating a society by breeding.
It's not any of that. It's just, like I told you, these people who do these research and the people who come out against us, which, by the way, is very few. You said people only support us based on certain things. Our supporters support us because they don't believe it's okay to abuse children. Our supporters support us for that reason. The people that donate money to us have children. They don't think it's okay to abuse children. Those on the left, those on the right, in the middle, everybody can agree on one thing, and that is that it's not okay to abuse children. This is child abuse. It's legal child abuse. If you get behind the wheel of a car and you drive drunk and you hit a child, you're going to prison. You've damaged a child. These women have victims as well.
You have chapters of your group all over the United States and hundreds, maybe thousands of supporters. You now want to bring the same philosophy to the United Kingdom. Different society, we have a national health service. We like to think that we have a national support program for drug abusers and indeed for families that are hit by drug abuse. Do you think that your plan to offer the same sorts of financial rewards for sterilization and contraception is going to work in this country?
We're here because 400 people that live here invited us here. They heard me on the radio, and I received over 400 emails from people that live here and in the area surrounding here saying, we need you in the UK. This is the greatest thing we've ever heard of. This is the most common sense to approach to a problem we have ever heard. I mean, we have people saying come here. We're here because we were invited. We didn't just decide to come here.
But, you know, we've contacted the key agencies working with drug addicts in the UK, and they, all of them, say that you are not welcome here, that your philosophy is counterproductive, and they point out that their approach, which is much more about the help and support for drug abusers to try and get them off the drugs and clean them up and work with families, they cite work which suggests they have extraordinary success rates when they go into families and try and help.
That works when the women want drug treatment, but they don't always want it. They don't always look for drug treatment. Sometimes they don't look for drug treatment for 10 years. So what do you do? What did they say that you do in that 10 years? Do you just allow them to go ahead and have children? I mean, what was their solution until they get in drug treatment? It might work if they get in drug treatment, but are you dragging them in there and making them go to drug treatment and get clean and never use drugs again? I mean, it doesn't solve the problem unless that's what's happening. So there's still women out there who are going to still use. They're not looking for drug treatment, and they're going to get pregnant.
So how far can you go with this? You're offering in the UK £200 for sterilization or long-term contraception. You've also said that it's not just about drug abuse. In this country, I think you're saying it's about alcohol abuse as well. So the same, rewards would apply. What about tobacco? Doctors say tobacco is just as damaging as other illegal drugs.
We don't have to do that. I heard you guys took care of that on your own. We heard this morning that you're paying people to stop smoking.
We encourage people to stop smoking and indeed not to drink, not to use illegal drugs.
That's very clever, though, to pay people not to smoke. Those people are just hurting themselves, though. What about these women? They're hurting others. So shouldn't we pay them to use birth control? They're not just hurting themselves. They're hurting others as well.
How long will you keep this up? You have, as I said at the very beginning, devoted much of your life to this. Is this a life's work now for you?
I mean, people support us. Most people support us. If you walk down on the street and talk to 100 people, 99 of them would support us. People agree that it's not okay to abuse children. And you can't give me one reason why a drug addict or an alcoholic should get pregnant. I don't think you could. A good reason why they should.
Barbara Harris?
I'm sorry.
No, don't be sorry at all.
I took over your show.
Don't be sorry at all. But at this point, I'm afraid we have run out of time. So thank you very much for being on Hardtalk. Thank you.